Hello everyone, this is Dr. Audrey Tai. I'm a board-certified and fellowship-trained refractive and cataract surgeon, ophthalmologist, and cornea specialist. Welcome back to my channel, Eye Channel by Eye Surgeon. In today's video, I would like to talk to you about 3 effective treatments that you can do at home to treat dry eye disease. You may have heard about many different types of dry eye treatments, such as eye drops, both the ones that are available over the counter and the ones available by prescription, and some other treatments that you can get at a doctor's office. But if you adopt the 3 at-home treatments I mentioned in this video and do them consistently, you should notice a significant improvement if you have mild to moderate dry eye disease. If you stay with me until the end of this video, I will go over the single most important component of any dry eye treatment. This is not a sponsored video, and the treatments I mention in this video are based on my own clinical experience. You may have already been doing some of the treatments for dry eyes I mentioned in this video, but you still feel your eyes get irritated, red, and tired. After watching this video, you may find the products you have been using or how you are using them may not be correct for you. I will also be posting a more in-depth video about the mechanisms on dry eye disease and different types of dry eyes. So make sure you subscribe to my channel so you won't miss any of my new videos. Treatment number 1, artificial tears. You may be thinking, I've been using over-the-counter dry eye drops many times a day, but my eyes are still dry and irritated. But which type of over-the-counter eye drops are you using? And how many times a day are you using them? Because using the right type of over-the-counter artificial tear eye drops will help to replenish the tear film on the surface of our eyes, but using the wrong ones can cause damage to the surface of the eye instead of helping to improve dry eyes. The tear film contains 3 different layers: a lipid layer, an aqueous layer, and a mucin layer. A good dry eye drop can help replenish and improve all 3 layers of the tear film. The over-the-counter artificial tear eye drop I recommend to most people to improve the health of all 3 layers of tear film is Refresh Digital. Refresh Digital artificial tears contain castor oil, which is a natural ingredient derived from castor beans, and it targets the lipid layer of the tear film by reducing evaporation of the tear film and extending the effectiveness of the artificial tears, in addition to the active ingredients of CMC and glycerin. An additional active ingredient in Refresh Digital is polysorbate. Polysorbate can help blend the oil component and the water-soluble component of the artificial tears to make the eye drops more soluble and easily spread across the surface of the eye. It is very important to use the preservative-free version of the Refresh Digital eye drop whenever possible, because there are special cells on the surface of the eyes called goblet cells. These special cells can be damaged when exposed to excessive amount of preservatives in eye drops over a long period of time, resulting in less healthy mucin in the tear film. The goblet cells secrete the innermost layer of the tear film, the mucin layer. The mucin layer of the tear film stabilizes the tear film and decreases the surface tension. It allows the aqueous layer of the tear film to spread evenly over the surface of the eye and protects the surface of the eye from damage. To learn more about preservatives used in over-the-counter eye drops, you can check out my video about dry eye drop ingredients. Typically, if you're using artificial tear eye drops more than 4 times a day, or if you use eye drops while wearing contact lenses, I highly recommend avoiding preservatives in the eye drops by using preservative-free artificial tear eye drops. The preservative-free Refresh Digital eye drops come in single-use vials, which can be costly and inconvenient. A good alternative is Optase Dry Intense Eye Drops. It is preservative-free and it comes in multi-dose bottle. It contains sodium hyaluronate and 0.2% glycerin. I've been using the Optase eye drop for the last few weeks and found the lubrication effect of the drop to be long-lasting. I've listed the links for those 2 eye drops below in the description of the video. You can check them out. You can also check out my video about my top 5 over-the-counter eye drops to help you find the right one for you. Treatment number 2, warm compresses. This treatment mainly targets the lipid layer of the tear film. The lipid layer of the tear film is very important in preventing tears from evaporating too fast. The lipid layer of the tear film is the outermost layer. If your eyes feel dry and irritated shortly after applying over-the-counter eye drops, or you feel like you need to put in eye drops over and over again, the lipid layer of your tear film is likely not very healthy. The lipid layer of the tear film is secreted by the meibomian glands located in both upper and lower eyelids. If the meibomian glands are clogged or not working, or the gland oil contains too many inflammatory particles, the aqueous layer of the tear film underneath, secreted by the tear glands, will not remain on the cornea for long enough to lubricate or moisturize the eyes. One effective treatment you can do at home to open up the oil glands is warm compresses. You may have already been doing warm compresses at home, but have not found it to be very effective. You may not have been doing them correctly. The key of getting the benefit of warm compresses is to keep the heat over your closed eyelid for 5 to 10 minutes continuously. The method of using a washcloth soaked with hot water often does not provide long enough heat to the eyelids, and you'll need to rewarm the washcloth a few times during each warm compress session. Heatable eye masks are designed to provide a more consistent and longer-lasting heat to the meibomian glands to help release the oil from the glands into the tear film. I typically recommend doing warm compresses once or twice a day, depending on the severity of your dry symptoms. I've listed the heat mask that I have been using myself in the description below. You can microwave the Brooder mask for 20 seconds and it will stay hot for 20 minutes. Treatment 3. Omega-3 oil supplements. The lipid layer of the tear film can also be affected by unhealthy gland oil secreted by the meibomian glands. This is typically due to increased inflammatory particles in the tear film. In this case, it is important to modulate and restore the health of the meibomian glands and their oil. This is where omega-3 supplements can come into play. Because omega-3 supplements are not a prescription medication and are not regulated by the FDA, their dosage and composition may vary greatly. Stay tuned for an upcoming video where I will take a more in-depth look for you into omega-3 oil supplements for dry eye disease. I'll put a link in the description below for one brand omega-3 oil for dry eyes if you would like to check them out. Please remember to always consult with your doctor before taking any high-dose omega-3 supplements to make sure that they're safe and right for you. In this video, I've mentioned 3 easy-to-do dry eye treatments that you can do at home. There are also other more invasive and advanced treatment options that require prescriptions and are typically reserved for more severe dry eye cases. To learn more about those treatment options, you can check out my video, What to Do When Eye Drops Are Just Not Enough. It is important to remember there's no one-size-fits-all treatment protocol for everyone. In my clinical practice, I prescribe an individualized treatment protocol for each patient based on their individual situation, and I tailor their treatment plan based on their response to each treatment. You can follow me on Facebook and LinkedIn at Dr. Audrey Tai to learn more about my practice. Thank you for staying with me throughout this video. As I promised at the beginning of this video, I would like to share with you the single most important component of any dry eye treatment. The most important thing you can do to ensure that your dry eye treatment is effective is to be consistent. If you only apply eye drops or do dry eye treatments when you are experiencing symptoms, such as redness, soreness, or irritation, the treatment effect will not be long-lasting. When you adopt any or all of the 3 treatments and do them consistently on a daily basis, the treatments will act as preventative measures to help prevent you from getting dry eye symptoms. I often recommend that my patients with dry eye disease use artificial tear eye drops 3 to 4 times a day on a regular basis, and do warm compresses and take omega-3 oil supplements daily. If you feel your eyes are still irritated or sometimes have blurry vision, despite using over-the-counter eye drops and other at-home treatments I mentioned in this video, it is important to have a full eye exam and talk to your eye doctor about what other treatment options might be right for you. Let me know in the comments below what dry eye treatments you are currently using and what your experience has been. I hope you find this video helpful. If you have learned anything new from this video, please don't forget to hit the like button and subscribe to my channel to help me bring you more videos about eye health and eye surgery. Thank you again for watching, and I will see you in my next video.